Hi, I'm Dr. David Hill, and today we're going to talk about chronic arthritis in children. Now, in medicine, when we say chronic, we usually mean something that's been going on for more than a month. Arthritis, of course, just is a word that means pain or inflammation in the joints. Now, there are a lot of things that cause children's joints to hurt, and some of them are really serious and concerning, so we want to talk about those things. One of the most concerning causes of a chronic arthritis in a child is an autoimmune disease known as juvenile rheumatoid arthritis. Joint pain is one of the main indicators. Usually you're thinking about larger joints, but it could be small joints. The pain is often symmetric, often felt on both sides of the body. It may come or go. You may also notice some redness, some swelling, or some tenderness to the touch where that pain is occurring. That's a really serious illness, and if you suspect juvenile rheumatoid arthritis, you definitely want to have your child evaluated by a doctor. There may be some blood tests that help, although blood testing is hardly a slam dunk for JRA. It can be very difficult to identify through blood testing. X-rays are sometimes helpful, but often a clinical picture is really what makes the call about whether a child has JRA or not. Also labs that rule out other causes of chronic arthritis. Children with JRA may also have headaches, fatigue, joint muscle pain in addition to joint pain, fever, pain on urination. They may have any number of rashes, mouth sores, other skin symptoms that lead doctors to suspect juvenile rheumatoid arthritis. Other arthritises can be infectious. One of the ones that gets a lot of attention and a lot of press is Lyme disease. Lyme disease, you know, is caused by a tick bite, but a lot of people don't realize how rarely children who have Lyme disease report the tick bite. So, you know, people say, well, I'm worried about Lyme with my child, but I don't think they got bitten by a tick. They never told me about it. I never found one. Only about half of those kids ever remembered the tick bite or ever noticed it. The tick may have crawled up, gotten a meal dropped off. Nobody ever saw that tick. So if you know that the child had a target lesion at some point, a red rash with rings that were kind of spreading out from a particular area, and had a fever, maybe they're still having an unexplained fever from time to time, and they're also having joint pains. There may not be swelling with these joint pains or redness, there may just be the pain, but you want to bring up that possibility. There are some other tick-borne diseases as well, such as Ehrlichia or Rocky Mountain spotted fever, that will also cause similar joint pains, so you can bring that up with the doctor as well. Now, bacterial infections can affect joints. Usually those occur acutely rather than chronically, but when there's a lot of swelling at one joint, especially if it's associated with a chronic fever, your doctor may want to ask an orthopedic surgeon to actually pull some fluid out of that joint and study it to see what's going on in there. Other rarer causes of chronic joint pain in children are illnesses like leukemia or lymphoma or bone cancer. Those things are all pretty serious. So the bottom line is, if your child has been complaining of really significant joint pain for over a month or even less than that, you probably really do want to get some help from that child's doctor figuring out what's going on, because we've got a list of pretty serious stuff and we need to get a look at that child and get a really good history, a really good exam, and probably some labs and even x-rays to figure it out. Talking about chronic arthritis in children, I'm Dr. David Hill.